Imagine going to the doctor over and over, but no one can quite figure out what's wrong with you. For millions of people, that's a reality. Their conditions are misdiagnosed, or hidden inside messy medical records. Now, here's the shocking part. In one NHS study, an AI system found 6 times more hidden patients than doctors had ever flagged. 6 times. And it cuts treatment costs in half. So the question is, can AI really save lives and billions by finding the patients we've been missing? The company behind this is called Pangea Data. They're based in London and San Francisco. Their mission is simple but ambitious: make invisible patients visible. And why is this so important? Because more than 70% of rare disease patients go undiagnosed or misdiagnosed. They fall through the cracks, not because doctors don't care, but because the system can't keep up. Traditional tools rely on codes and keywords, but real patient stories are buried in unstructured notes, scans, and lab reports. And that's the gap Pangea set out to fix. The platform is called Pollux. Here's how it works in plain English. It reads unstructured clinical text, doctor's notes, discharge summaries, and messy stuff. It uses deep natural language processing plus medical guidelines, so it reasons like a clinician, not just matching keywords. All of this happens inside the hospital firewall. No patient data ever leaves. And when it flags a patient, doctors see why through explainable dashboards built on their EHR systems. Think of it as the world's best diagnostic clinician reviewing every single patient file automatically. Now let's get a little more technical. Under the hood, Pangea's AI uses transformer models similar to BERT or MedBERT, trained specifically on clinical text. And here's the twist. These models are configured with medical guidelines, so they mimic how doctors reason through a case. It also runs in a federated way. That means the AI lives behind the hospital firewall and patient data never leaves. And this privacy by design approach is why hospitals trust it. But here's the catch. Rolling out a system like this isn't cheap. Deployments can cost between £50,000 and £300,000. So what about smaller hospitals or countries with tighter budgets? A lighter version is possible. Clinics could use open source NLP models like Clinical BERT or MedGPT. They could start with pilot projects, export anonymized nodes, run them through NLP and look for patterns. For privacy, they could use a secure cloud setup like Azure Health Data Services, but scaled down. And for dashboards, something as simple as Tableau or Power BI could work. It won't be as seamless as Pangea's polished system, but the principle is the same. Don't rely only on codes and keywords. Dig into the unstructured nodes, because that's where the invisible patients are hiding. Let's look at one flagship case. Cancer cachexia, a severe wasting syndrome that often goes unnoticed. In a study of 8,483 NHS patient records, doctors had identified 41 known cases. Pangea's AI spotted those 41 and then flagged an additional 253 hidden cases. That's 6 times more patients. And the impact: earlier treatment, better nutrition support, and lower cost. Average spending per patient dropped from £10,000 to £5,000. Scaled across the UK, that's up to £1 billion annually NHS savings. And this isn't just one disease. Pangea has applied the same approach to over 7,000 conditions, from kidney disease and Crohn's to glaucoma and ovarian cancer. Pharma companies are also using it, not just for care, but to recruit patients for clinical trials who would otherwise never been found. And of course, nothing this big comes without challenges. Hospitals have messy IT systems. Integrating AI into records isn't plug and play. Clinicians need to trust the system, and if AI feels like noise or second guessing, they won't adopt it. Costs are another barrier, 50,000 to 300,000 per hospital, plus ongoing maintenance. And skeptics rightfully warn those £1 billion savings, they may be extrapolated from small pilots. We'll only know if they hold up at a national scale. So what can we learn from this case? First, start with the right problem. Pangea focused on blind spots where the payoff was clear. Second, build privacy in from the start. No patient data leaves hospital control. Third, outcomes matter more than hype. Numbers like 6 times more patients and half the cost are what convinced leaders. And finally, the best AI doesn't replace people, it empowers them. At the end of the day, this isn't just about saving money, it's about saving people, the invisible patients who until now were missed. So here's my question to you. Should every hospital adopt AI like this to find the hidden patients? Or is it too risky to let algorithms guide who gets flagged for care? It's an interesting question. If you found this story insightful, hit subscribe, because next time we'll explore another real world AI pivot that's reshaping an entire